Hello, I'm Amber. I'm a nursing assistant who is part of our Health and Safety Committee. I have been asked to talk about hazards that affect our nurses and how we can prevent them here at EnviroCare. To start, we are a private company of over 70 staff members and growing here in Toronto. We provide concierge nursing services for post-operative care. This is provided by experienced registered nurses who have extensive backgrounds in the ICU and surgical care. These services allow you to recover in the comfort of your own home or hotel because surgery, no matter how big or small, can be scary. So we want to be there for you and your family. Concierge RN will come to you and provide a relaxing atmosphere that is conducive to your healing. They will stay with you overnight if needed, do wound checks, give medications, and prepare light meals for you that hydrate and help you to debloat from the swelling. They will educate you and your loved ones about your condition. They will communicate and advocate for you with other healthcare professionals as needed. Most importantly, professional, patient-centered, empathetic, and loving care for you or your loved one will be provided. Nurses not only have to put patient safety first, but also must take into consideration their own personal safety. Workplace safety for nurses receives less attention than patient safety, and we here at EnviroCare have a power to change that. Here are the most common ones we see in our line of work. Beginning with the most hazardous, we have back injuries, slips, trips, and falls, infectious diseases, violence, chemical hazards, and latex allergies. Violence is more common than you think. According to the CDC, nurses are more often the target of workplace violence than any other category of healthcare worker. The environmental risk factors associated with assault and healthcare workers is inadequate training, staffing patterns, time of day, and containment practices. Studies show that inexperienced workers and nursing students are at an increased risk of assault. Most of these injuries happen in the process of containing patient violence, and the rest are battery injuries. Then we have back injuries. These are the most common injuries nurses suffer from. Posture and physical load play a role along with lifting and assisting patients. Years of working in this profession does have a toll. However, studies show younger nurses are at a greater risk. Inexperienced and newer nurses lack the training. They are so focused on getting the job done that they don't follow proper procedures. Then we have falls. These are another physical injury that nurses suffer from. Slips can occur when floors or other working surfaces become slippery due to wet or oily processes. This includes floor cleaning, leaks, or for materials and debris that are left in walkways. Uneven floor or working surfaces can lead to trips. Most slips, trips, and falls are attributed to hazards that can be lessened, like water on the floor or loose cords in a hallway. As a nurse, infectious diseases are something we deal with daily that are a major concern. Nurses are frequently exposed to hepatitis B, MRSA, a superbug, TB, and HIV. Exposure to bloodborne pathogens sometimes occurs during a needle stick injury, which experts estimate happens to 800,000 healthcare workers every year. Hazardous chemicals are associated with all sorts of acute and chronic health problems, but are still used widely in healthcare facilities. They come in many forms, such as cleaning products, disinfectants, sterilizing agents, dangerous gases, and chemotherapy drugs. If nurses are exposed, they could suffer from acute asthma attacks or other side effects. Pregnant nurses face an additional risk to their unborn babies from exposure to these chemicals. It is unlikely that we will ever be able to remove all hazardous chemicals, but attempts should be made to use safer alternatives where possible. Any nurse using these chemicals should exercise caution and follow proper protocols. Unfortunately, allergies can develop at any time. A mild allergic reaction might cause dermatitis, while a severe allergy can trigger anaphylaxis. Dermatitis is also an issue to be on the lookout for. A study has revealed that healthcare professionals who adhere to proper hand hygiene protocols are the most likely to have moderate or severe cases of contact dermatitis. Glove use and moisturizing can help with this. Vinyl gloves can safely replace latex when nurses are allergic. As staff, there is more awareness and education needed. Much can be done through behaviors, purchasing decisions, care protocols, direct care, along with patient and community education. Preventative measures need to be taken to help reduce these hazards. Staff should wear PPE, especially gloves, during client visits. To avoid allergies, we can switch to vinyl gloves. When working with chemicals, we should exercise caution and follow proper protocols. Staff should use proper posture and get assistance to lift patients in heavy loads. Staff should also be involved in our health and safety committee. Safety programs and procedures for in the office, on the road, and in client homes should be better followed. Clients can help by keeping their driveway, sidewalks, stairs, and ramps free from ice, snow, moss, and clutter. By keeping entrances well lit, by not drinking alcohol before or during visits, keeping pets in a separate room, as well as letting their nurse know if there's anyone else in the home. Ensuring safety is a team effort. Nurses are essential, and their health and safety should be a top priority. Failure to keep nurses safe from workplace hazards, illnesses, or injury can have direct consequences on patient care. Over time, when nurses suffer from workplace hazards, they're likely to retire early or change careers, which can contribute to the looming nursing shortage. Those who stay on the job may experience job dissatisfaction and burnout, which research has linked to higher rates of poor outcomes, like hospital-acquired infections. When healthy, well-rested, and safe on the job, they have more life and job satisfaction overall. This has a positive impact on patient outcomes and quality of care, as well as 50% less money being paid for time off for injuries. Nursing is a very demanding career. It is described as a science and an art that focuses on promoting quality of life as defined by populations, communities, families, and individuals throughout their life experiences from birth through the end of life. Nurses need to exercise caution and follow proper protocols when it comes to their health and safety. No community would be the same without them. Thank you.